Good day, everyone, and welcome to today's Black Health Trust. I'd like to turn it over now to our founder, Dr. Randall Maxey.
Thank you, Dr. Walks, Dr. Neighbor Stevens, Dr. Hind, and Dr. Lawson, our honored co-host. We have an interesting program today with a follow-up on two previous programs. We luckily have a very accomplished guest. But first, I want to express my prayers and concerns for the multiple tragedies that continue around our country and world. There were major shootings in Rhode Island. I'm sure there's some that we haven't heard of yet, but it particularly caught my attention because it happened in the School or College of Engineering at Brown University during final exams, where several people were actually killed and multiple people were injured. Also, there was a big slaughter in Australia as well. And I'm just concerned that we have so much evil things happening in our world that we need to stay prayed up. But I want to introduce our very well-known guest today, who's Dr. Tamora Dixon. She holds a Doctor of Dental Surgery degree. She's a cosmetic and wellness dentist, and she specializes in how oral health can affect the entire body, whether it be your brain, your heart, your kidneys, and we talk about this all the time. So rather than take any time to introduce her further, she's my friend, and I had the ability to introduce the person I call my dentist to Dr. Beverly Johnson because I wanted her to hear this wonderful, talented young dentist. Dr. Tamora Dixon, the stage is yours. Thank you.
Thank you so much. It's an honor to be here again to continue the discussion that we were having before. I'm going to recap some of the stuff real quickly and then go on to show a little bit of the research. And I'm going to get that going now. Okay. It's not starting. Oh, for some reason, it's not starting. Hold on just a second. Yeah, I got too many screens up. Can you guys see that screen? Can you hear me?
I can see the Zoom screen. Okay.
Yeah, but for some reason, this other one is.
So if you hit the slideshow button.
Okay, there it goes. Okay, I see it.
And then go over to where it reads from current slide.
Oh, there we go.
There you go.
Yeah. Thank you. Okay, so the thing we're going to talk about today is the shocking oral health impacts of the body. So we're going to see how the health of the body is affected by their oral conditions. I'm located on Sepulveda in Los Angeles near LAX, and my office number and my website is right there. I'll go back to that at the end. Okay, what your mouth says about your health. There is more to plaque than meets the eye. Oral systemic health. Bacteria in the oral cavity does not stay there. Oral systemic health is the downstream effect that oral bacteria has on the rest of the body. This bacteria is associated with various health conditions such as heart disease, stroke, diabetes, Alzheimer's disease, aneurysms, rheumatoid arthritis, pregnancy outcomes, and even some cancers. And I'm going to get into some of the research on those various topics. And what we want to get out of today is for you to be able to describe which systemic diseases and conditions are related to oral health. We want you to be able to summarize 5 questions that can be utilized to assess oral health. So in a physician's office, they usually do not ask about oral health. So I'm coming up with 5 questions that you can ask your patients about their oral health, or that you can put on your intake forms. Also, we want to discuss the strategies for collaborating with oral health care providers for treatment of these risk factors. Okay, systemic oral health. A lot of times in medical school and dental school, they only talk about how the different diseases show up in the mouth. So that's the only direction that they talk about, the systemic oral connections. They don't talk about the oral systemic connections so much. The systemic oral connections that manifest in the oral cavity are things like HIV, which shows up as hairy leukoplakia, and candidiasis, HIV candidiasis. They'll come in your office and say, oh, something's going on with my mouth, but sometimes you guys will just be like, oh, go to the dentist or something like that, or oral pathology. Sexually transmitted diseases also show up in and around the mouth. As you can see, the herpes lesions that show up along the vermilion border of the lip. You can see once it crosses that border, it's herpes. People say cold sores and stuff like that. And then this is how it would express in the palate. So if someone comes in and their palate's like that, they're having an outbreak. We can see they're having a herpes outbreak. We learn all that in school. We also learn other manifestations in the mouth, which is like HPV, which is on the rise. Chicken pox, we can see that in the mouth. It's in the herpes family. Epstein-Barr virus is also a member of the herpes family. Coxsackie virus, hand and foot mouth disease, syphilis, and tuberculosis. Autoimmune diseases can also manifest in the mouth, and we usually can see those like in the borders of the cheeks and stuff like that. Gum disease is an infection, and that's what people don't understand. And they'll say they have bleeding gums, but they don't associate it with it's an infection. And so we really need to try to change the terminology and say my gums are infected instead of I have gingivitis. They'll say gingivitis, which is putting it nicely, but it's an infection caused by bacteria. It's the #1 cause of tooth loss in the US. It's bad for your health. It's a silent, progressive, destructive disease, and it is a disease that travels throughout the body. Watch your mouth for these symptoms of gum disease. Bad breath. Gum infections can cause bad breath. Swollen gums. Infection can cause the gums to swell. Bright red gums or changes of color of your gum tissue. Bleeding gums, of course. Healthy gums do not bleed during brushing, flossing, or dental exams. Pockets or spacing between your teeth, gums, and bone, or tender or painful gums. So what we do for periodontal disease, we use these probes and we put them down into and around the tooth in 6 spots on each tooth to see where you have bone loss at or inflammation. So this is inflammation here. And sometimes it goes all the way down. So you know this patient don't have any bone around that tooth. And you can also see that on dental x-rays as well. But this is a patient who has gingivitis probably here, gum disease down here, or periodontal disease. So this is what I was telling you guys before about the Bell-Donine method, how they have these like 6 or 7 things they check. And if one of those are out of whack, they'll send you to the dentist to get exams so that you can make sure that you don't have any infections in your teeth causing those problems. So one of the things they did was this research shows that they had gotten the clot, the thrombus, out of like 101 people who had a heart attack. And they used a DNA analysis to look for oral pathogens in the clot that caused the heart attack. So they collected arterial blood samples from each patient to do the analysis. They found the DNA and plaque deposit had ruptured through the artery wall. The DNA analysis showed that 75% of the clots had oral bacteria that cause dental cavities, and 35% of the clots contain bacteria that causes gum disease. Another startling discovery, the team performed oral x-rays on 30 of the patients and discovered that half of them had infected teeth. These patients were 13 times more likely to have oral pathogens that cause dental cavities in the culprit blood clot. The researchers then examined 9 of the clots with the electron microscope and found fragments of oral bacteria in 100% of the clots. And in 3 of the clots, germs were still whole. So it's startling. These findings suggest that 50% of heart attacks may be triggered by an infection in the mouth. This is an infection that they found on the x-rays. So this is called an abscess. And this abscess is highly related to heart attacks. So you have a broken tooth and it's just a root tip sitting in there. And you'll be surprised at how many people are walking around with broken teeth with root tips sitting in there like that. And the minute I see it, that's the first stage of treatment, is to get rid of all infections. So what I do is get rid of the cavities, get rid of the gum disease, and get rid of these teeth like this that are non-restorable and have infections that I know can go to, distant locations. So one of the excerpts from the book is a study that was done in California. So I want to go over that. They had, it says, a habit that takes 5 minutes a day can add years to your life and also reduce risk of heart attack, strokes, diabetes, colds, flu, and even arthritis. A 2012 study found that one of the simplest and cheapest ways to a long life is brushing and flossing your teeth daily, but you have to floss correctly. Conversely, neglecting your chompers can actually be fatal, the research reported. Just how much impact does good oral health have? California researchers tracked 5,611 seniors for 17 years and found that never brushing at night boosts the risk of death during the study period by 20 to 25% compared to brushing every night. So just that one habit, brushing every night, can increase your longevity. Never flossing hiked mortality risk by 30% versus daily flossing. Not seeing a dentist in the previous 12 months raised the risk of death by up to 50% compared to getting dental care 2 times or more per year. Another startling finding was one major predictor of early death was missing teeth. Even after other risk factors were taken into account, the study reported that powerful motivation to see your dentist regularly and fight heart disease with a toothbrush and floss. So this book is really good if you want to get more into oral systemic connections. So this is a first article that I found doing my research in this about oral connections, oral systemic connections, was in 1900. So this doctor, who was a medical doctor, was talking about gastritis and how the gastritis could cause different diseases. And he says, I have to point out that for every cause of gastric or other affection traceable to Pyorrhea alveolaris, that was the name they used then for periodontal disease, which is, eating the bone. 100 cases equally well marked are daily to be found associated with other dental and oral conditions of sepsis. In short, I deprecate this subject of oral sepsis and its effect being brought under discussion in connection with any other oral pathological condition of the mouth. The list of such conditions might be increased almost indefinitely. So he's saying that he's seen this in 1900 and he's like, there's no telling where else this bacteria is affecting, and it's probably everywhere. And so this was a really, really good article that he saw, but he was finding it in gastritis and at the time stomatitis, which is when they were like wearing their dentures to bed and 24/7 not taking the dentures out, and they find root tips and infections underneath the teeth and all this gastritis in their mouth, like they're constantly swallowing this infection. And so it's really interesting there. Okay, let me keep going. So this is one on heart disease, and it's like comparing the endothelial function in healthy patients to myocardial infarction patients, heart disease patients. The conclusion was that the endothelial function was impaired in chronic periodontitis patients when compared with the healthy controls to the dysfunction observed was similar in that of the myocardial infarction group based on these values. So when the bacteria is going through the arteries, it's making the endothelial part of the artery thicker. So it's thickening the lining of the artery. And so when that lining gets so thick and it bursts, it causes a thrombus, and all that bacteria is in that heart attack thrombus. And that's how they find the dental bacteria in the clot. This other one is periodontal disease as a risk factor for fatal coronary heart and cerebrovascular diseases. Poor dental health is associated with an increased risk of fatal coronary heart disease. So let me go by a couple of more. The detection of oral bacteria and cardiovascular specimens. They're showing their results suggest a specific oral bacteria species, such as S. mutans, which is like a cavity bacteria, and A. actinomycetum comitans, which is a periodontal bacteria, are related to bacteremia and may be etiological factors for the development of cardiovascular disease. So that's saying that they may cause it, period. Another one is about acute and stable coronary artery disease, and it's high levels of that AA. And that's the one we test to in our bacteria testing. And systemic exposure to that bacteria is associated with increased risk of coronary artery disease. So that's just showing you there's some research there. This one was from 2012, and this one was from 2009. This research has been going on a lot, and it's getting more and more up there. This is another one, and it's about aneurysms. And so aneurysms are also related to dental infections. It could be part of the pathophysiology of intracranial aneurysm disease. So they found the bacteria in 21 out of 36 participants. A third of the positive samples contained DNA from both endodontic, that's that infection that I showed you at the tip of the root, and periodontic bacteria. DNA from endodontic bacteria were detected in 56%, and from periodontal bacteria in 47%. Bacteria DNA, Streptococcus mitis group was found to be the most common, and then the AA group and the FN and the TD, Treponema denticola, they were the three most common periodontal pathogens. Those three are part of the ones that we test with the oral DNA testing that you could also do in your office, and we'll talk about that too. So this one was done in 2013. So this research has been around for a while. So we talked about dementia last time, but this researcher, I took her class a long time ago, probably like 2014, 2013. But she was talking about the treponemas, which are spirochetes, and how they find those in dementia patients. And that's what this is. And she's saying the global attention and action is needed to support this emerging field of research, because dementia might be prevented by combined antibiotic, antiviral, and anti-inflammatory therapy. So that's something that really, it doesn't get enough attention, in my opinion, because it's not common knowledge, and it should be with you physicians. Cancer. So this is like showing how saliva tests are getting more popular to see different types of diseases. High salivary counts of certain bacteria are seen in certain cancers. And so they just test the saliva, and like say pancreatic cancer, they have certain bacteria that show up higher in those patients than in regular patients. And so that will be a cause for concern. The diabetes, we talked about that last time as well. The management of diabetes, there's increasing evidence for a link between periodontal disease and cardiovascular disease. We know that. As a healthcare professional, you can help prevent diabetes complications by referring people with diabetes for routine dental care twice a year. The National Diabetes Education Program has free information and materials for healthcare professionals and people with diabetes. Now, I had a patient come in the other day, and she said that she actually works for a doctor who does diabetic education. She's a retired doctor that does diabetic education, and they do not talk about oral health at all. And in most diabetic education programs that I have seen, do not mention oral health at all. This is a diabetic patient. I think I was telling you guys before how I would just know the patient had diabetes, and I would tell them, are you diabetic? And they were like, yeah, how did you know? This is one of those patients. So I was working at a clinic, and I saw this patient, and I'm like, are you diabetic? And she says, no. And then her mom says, yes, she is. She just started taking metformin. And the patient was 12 years old, and she had this type of infection where you can touch her gum and it'll bleed. So I knew that she was probably diabetic. The bone loss, she has an aggressive bacteria because you can see her roots of her teeth down here. This looks like somebody like in their 40s, and this girl is 12 years old. And so at the time, I was just working at on my off days, helping out the clinic if they needed a fill-in. And so he was sending me out there like every Friday because I was off on Friday. And so I told the little girl, make an appointment next week, because the other doctors were not going to do it. So I told her to make an appointment. I'll do her. But that next Friday, he sent me somewhere else. So I don't know what happened to this little girl. So what we want to do is collaborate with physicians and with Oral Systemic Connections. So it's this is in 2017. So it's still not really a lot of physicians referring their patients to dentists because they don't really know, number one. But the environment of the literature now, what's impacting it is the cross-disciplinary practice patterns, the updates of the epidemiological studies, the risk assessment and screening. And so the thing about it is a lot of physician offices aren't screening for these diseases, which they should be. And I'm going to add in sleep apnea to that as well. So screening for oral health and screening for sleep apnea should be routine in a physician office, a primary care office. So these are the questions you want to assess oral health in your practice. And you may want to add this to your intake forms. When was your last dental visit? So their last dental visit was over a year ago. You want to suggest they go see their dentist. Do your gums bleed when you brush or floss? If they say yes to that, they need to go see their dentist probably immediately. And if they also have diabetes, it's even more urgent. Do you have any teeth that bother you? So they say, yeah, I have a toothache. Those toothaches are usually infections that are of the root areas. So they're called endodontic infections, and they're like the ones I showed you on the tip of that root. You need those out immediately. Or they can, if they have enough tooth structure, they can get a root canal and a crown. Okay, and then you could ask them, do they have any broken teeth or cavities? Because some people have broken teeth down to the gum and they're just walking around like that. And those need to be taken out immediately. And another question that you can ask are either of your parents denture wearers? Because that would give you an assessment that they may have that type of bacteria in their genetics. So to conclude, the oral health should not be overlooked when considering general health. Genetic and bacteria testing are new tools that can be used to deliver more personalized dental care. So when I do my saliva testing, when I get the results back, they also have a recommendation for antibiotic therapy. So you can, when you clean it out of their teeth, you can also clean it out of their system because they won't have that bacteria going through their bloodstream anymore. And then make dental visits a priority in healthcare, brush, floss, and rinse daily. But I also want to add about sleep apnea too, because it's a chronic medical sleep and breathing disorder that is characterized by repeated episodes in which the tongue, soft palate, and other related tissues collapse the airway during sleep, reducing the amount of oxygen delivered to the lungs, One apnea is if you stop breathing 10 seconds or longer, they count that as one apnea. And some people get up to like 80 times per hour, 50 times per hour. But normally for mild to moderate, it is 15 to 30 times per hour. And we treat those with oral appliances. So to screen for that, you can use this stop bang, or you can use the Epworth study, the Epworth screener, I mean. And so that Epworth screener just asks a few questions, and if they score 10 or more, refer them to get a sleep test. So the next thing you would do is if they score 10 or more, refer them for a sleep test. And then once they get their sleep test, they can do it at home with a little ring they put on their finger, and then they do it digitally. And in the morning, it's done. We can read the results right away. The treatment options, if they do have sleep apnea, they have positional therapy, because some of the sleep tests, they do positional tests as well. So almost like you're going in to get it done, they put a strap around you and they can tell what position you were in when you were having the apneas. If you were in laying on your back and you had the most apneas there, you could get a like positional therapy. So it could put a belt on so that you won't roll over on your back, and then test again and see if it's going away. The oral appliance therapy opens the airway. So it's like this down here. You can see, let me see if I can make this bigger. This one. So you can see on this is their regular mouth when they're breathing. So you can see how small this area is. So that's when you have obstruction. When you move the jaw forward, you open this area so you get all the oxygen in. So if you have a mild to moderate sleep apnea, this oral appliance will work just as good as a CPAP machine. Now, this is a CPAP machine right here. So people don't like to really sleep like this. They're not that bad anymore because they have like nasal strips. They have nasal strips that you can use so you don't have to have all this on like that. But this is how the traditional CPAPs were looking. And that's, people are not compliant with CPAP treatment. They're more compliant with oral appliances. And so that's why they're pushing more oral appliances if you're mild to moderate sleep apnea. So another thing, they can do biometric, bariatric surgery and GLPs and stuff like that. That helps if the weight is the reason why they have the sleep apnea. If it's their tissues back here, like big tonsils or a lot of extra tissue in the palate or a big uvula or something like that, they can do a surgery to just get rid of all that tissue back there. And then that opens up the airway. And then also there's the Inspire. So that's like a last resort. If your CPAP doesn't work, oral appliance is not working, you just want an implant in your chest, they can put an implant there, and it stimulates to keep your airway open. And those are not having that great of success as they thought they would, because there's a lot of complications with those right now. So I guess they have to, get them a little bit better. So I'm ready for questions.
Well, thank you so much, Dr. Dixon. I appreciate you. I learned an awful lot. One of the questions I have is about genetic testing.
Mm-hmm.
Can you explain a little bit more about how that can help?
Oh, yes, because they have, there's a genetic test that Oral DNA does, and it'll say if you have, if your parents basically pass down the gene for gum disease to you. And that one is more done in, I would say, children, because if you're an adult, I can already see that you have gum disease. So I don't really need to do that test. But the test, I do the test to show which exact bacteria you have so that we can fight that bacteria. And it's called Oral DNA. Let me see. I'm gonna see if I can go and get a slide of that and show you. Are you guys still there? I can't even see you.
We're here.
Okay. Let's see if I can pull up some oral. May not have done that. Okay, here's one.
Do you know what specific gene it is?
No, I think it's interleukin 6. I think is IL-6. I think they look for that. I've done it a couple of times, but it's been a while since I've done that test. The test I do more is for the MyPeriopath that'll tell you which bacteria that you have under your gums and how we can fight it. And so I need to put you back up here.
Dr. Walks, are there any questions in the chat?
Yeah. So this would be like a test right here. If you can see can you guys see this?
Yes.
Okay, so this will be the test, and it's called Oral DNA Labs. And so you could do these tests in your office. There are procedure codes that you can bill for, and I can get those to you as well to assess your patients. But then after the treatment, you test again and see like all of this is gone except this one. And sometimes that happens. Like it depends on how long they tested too, but they got some here that they didn't have before. And so when they do that, these red complexes are the worst ones because they're the ones that a lot of research are on, and some of these are a lot of research are on too. That they show up in heart attacks, strokes, and all that stuff. So what I used to do is give them a whole report and say, hey, these are the bacteria that you have on your test, and these are where they're found in the body: diabetes, heart disease, cerebral aneurysms, aortic aneurysms, rheumatoid arthritis. Then this one is diabetes, rheumatoid arthritis, heart disease, stroke, dementia, pancreatic cancer. So those are the kind of things. But now with the new version that they have, they are putting that result on the test results. So I don't have to go and do a personalized one anymore. I just can give them this one, and it'll show different cancers and cardiovascular disease. So it shows all the bacteria and where they show up in the body here. Some of them, though, are not on there that I have researched, but I'll usually just tell the patient if it's something else.
Dr. Walks?
So there is a question in the chat from Dr. Lisa Curvendala about what is the best way for a general practitioner to screen for sleep apnea in the office.
Can you?
Yeah, I heard it. The best thing to do is to get some stop bang. You could just go online and look up a stop bang questionnaire or an Epworth questionnaire. And when they fill out their paperwork, have them fill out that questionnaire. And then if you see that they have anything like that or conditions related to it, I can get you guys one that'll have the conditions on there too. So if they answer these questions and they have conditions, then they'll be eligible for a sleep test and oral appliance or CPAP.
Can we open the mic for Dr. Dawes a moment?
Hello.
Hello.
I am in Jamaica, so West Indies, so it's different here, and there is a marked increase in obesity. To do sleep apnea testing is very expensive here. There's only one person that does it, and it goes to a sleep lab, and most people cannot afford it.
Well, so, the stop bang screener is very predictive of sleep apnea.
Okay, no, I can predict when they have apnea.
If you can't, yes. Excuse me?
I can predict most of them when they have sleep apnea. Because there are a bunch of apps I tell them to use, or they can just record. And
like Snore Lab.
Yeah. And
the thing about it is everybody that snores does not have sleep apnea, but everybody that has sleep apnea snore. So if somebody tells you they don't snore, then they don't have it.
Okay. But once you get past that point, in
Mhm.
order to actually test how severe it is and get treatment, what could I do in Jamaica, which is third world? Because I said we only have one sleep lab that tests
Mhm.
for it, and it's very expensive. You have to stay overnight. Are there
Mhm.
means of doing it? We don't
Okay.
have anything oral here. It'd be interesting.
Okay, I can give you a there's companies that you can get devices for, and you can test them with a device. They can take it home, they can log in, or you, but basically with the device, it goes on your finger. So you just basically register it to them, sign up with this company. I have to get with you, so I need to get your information.
Sure, I would love that.
Yeah, and it's so easy. So then they do the test, you get the results, you get the whole sleep report, and they tell you what their AHI is, and then you could go from there as far as, do they need a sleep pad, a sleep
AHI.
yeah, the the apnea hypopnea index.
Okay.
So that number is what the sleep test, what you're looking for.
Okay.
And also you want to look for their oxygen levels, because sometimes their oxygen levels drop so low that if they were at the hospital, they would have called a crash cart.
Okay.
Yeah. Dr. Walsh, any questions you have, comments?
So just drop me your information on here and I'll contact you.
So Dr. Maxey, Dr. Lawson is on and we can unmute him. He has some comments in the chat about oral health and those folks that have mental illness diagnosis.
Okay, let's invite him to talk.
Okay, I just want to note in the mixed point I made before, and that is that many people that go to mental health clinics get all kinds of treatment evaluations, but do not get oral health evaluations. And those in otherwise well staffed, well instrumentalized mental health hospitals just don't get oral evaluations. And the result is that there's a vicious cycle. People are embarrassed, they get depressed, they get anxious, all of the conditions that contribute to worsening mental health. And many times they can be treated, even when oral problems are discovered, they often do not get referred for help. For economic reasons, for the lack of relationship between mental health treatment and general dental care. And the unanswered question, I checked the literature. Apparently, no one's done a study to see if, in fact, the oral bacteria has any kind of impact in terms of mental disorders directly. We know there's good evidence in terms of Alzheimer's, dementia, and so forth, but I think it's well worth it to look at and see if it contributes to mental disorders.
You're absolutely right. There's a research article that I found that was from 1916. And one of the things they found in one case, it was somebody in the mental institution and they found teeth problems. They fixed her teeth problems and she got better. So it is a connection there. And there is some research there, but it's sad that they don't have the care that they need, and it's a lot of other mental health people that don't get dental care that they need. And if they have to go to a clinic, they don't get good dental care. Once it gets so far, it's just like they need someone who focuses on oral systemic care.
I think Dr. Sherrod had a comment or question.
Yes, if we can unmute Dr. Sherrod, there we go.
Oh, good afternoon. I just want to commend Dr. Dixon on such an outstanding lecture. And this is so important. And I'm wondering, I have two questions. One is concerning root canals.
Mhm.
Are you familiar with the data from Dr. Mayo, the founder of the Mayo Clinic back in the 1930s, looking
Mhm.
at root canals, where he actually did research and extracted root canals from patients with autoimmune disease and planted them in rabbits. And each time he did that, the rabbit would develop the same illness, autoimmune disease, that the patient had whose tooth he had extracted.
I
And
have
so,
heard.
and then the question is, in view of that data, what are your recommendations concerning root canals now? And do you have any experience with that? And the second question is, are you giving these lectures also to your colleagues? Because I find that you are brilliant. And I've been in the dental community for the past couple of years because I have a lot of problems. My mother lost all her teeth before she was 40, so that genetic stuff. And then it's very important. And I want to find out where your office is so I can come myself. But
Are you in
anyway,
Los Angeles?
yes, I'm in LA.
Oh, yeah. I'm in Sepulveda in Manchester,
Oh,
right
and
next
that's
door
not
to
far from
IHOP.
me.
I'm in
Okay,
in the Abdi Loyola building.
okay. Sounds good. I need to come see you and talk
Yeah.
because I think there may be some genetic relationship in my family because my brother lost all his teeth before he was 40, and my mother
Okay.
had lost all hers.
Well, that's
Dr. Scott,
definite.
one thing that I want to encourage Dr. Dixon to do is come to the Charles R. Drew Medical Society,
Yes.
especially the Black women physician. And I don't know if she's been to Puerto Rico before, but the NMA is meeting in Puerto Rico next year, and I think she ought to be there and talk to our physicians in Puerto Rico.
I agree with you, Dr. Maxey. We need to make that happen.
Yeah.
This is very
I
important
did a
information.
lecture when I did a lunch and learn at Charles Drew. Um, in is it Compton or for Wilmington? I did a lunch and learn there before for the physicians, and I also lectured for some of the master's students in
Yeah.
biological sciences.
Yeah. Our new president for the Charles Drew is Dr. Renee Poole, so I'm going to make sure the two of you know each other.
Okay,
Okay.
but I have done some stuff up there before.
Dr.
Dr.
Perez
Hazel?
is in for another year, Dr. Maxey, and then Dr. Poole will come in. So Dr. Perez is the current president of the Charles R. Drew Medical Society. But I think you're talking about the university, Dr. Dixon, on
Yes, I
Wilmington.
am.
Yeah,
Yes, I
you
am.
gave lecture to the medical students in the medical school, which is good, I think, because it needs to start there.
Yeah,
That
actually
learning.
it was the master's program in biological sciences. So they were all getting ready to go to med school.
Is
So it's
Okay.
even better to
Dr.
start
Wilks?
before.
Dr. Wilks?
So, let me just start by saying, once again, Dr. Dixon, thank you. We can continue and continue because this is one of those things that is so important and at the same time so not talked about. And it's just I'm just blown away every time that you're able to come and talk with us about it. The other thing is just a word of warning that now that you know Dr. Maxey, you're gonna get to know everybody. So
Oh,
I'm
good.
sorry.
I
I'm
want
sorry for
to.
all of your free time that you used to have. We
He
can
gonna take it.
we take it. I was talking with a dentist that I know, and I don't know if I got this correct. So I don't want to accuse anybody of telling me anything because if it shocked me, and I said, "Are you serious?" And I said, "Let's ask Dr. Dixon about this," and here you are. So he was telling me that there's some study or benefit or something like that of using regular bleach and sort of doing a mouth rinse with some concentration of bleach. And the whole thought of it scared me. So can you speak to whether that is a real thing or not? And should I already got the coconut oil from the last time you talked. So do I need to go pick up the bleach now?
Right. There is something to that. And so there was a company that was called Carry Free, and they had different things that you could use. And one of them was a bleach rinse. And you put like 20 ounces of bleach and maybe 6 drops of a dropper of bleach in the water. I mean, 20 ounces of water and like 6 droppers of bleach, and put it in your water pick and go through your mouth like twice a week with that. It was a twice a week rinse. I think I have a slide of it actually,
Okay.
but I gotta
You know,
find.
people just tell me anything, so I always have to ask the
Right.
next.
And you have to have the ratios right and all that. It ain't just like open your mouth with some bleak. No, don't do that, please. It's
Thank
not
you.
like that. I have to find that slide. I do have
Okay.
it though.
If you can send it, because you know part of my question about that goes back to expand a little bit on what Dr. Lawson was saying. Dr. Lawson always raises very important points in the mental health community, and one of the things is that a lot of folks who do have some sort of a mental health challenge will sometimes also be resource impaired because of their maybe serious mental challenges. And a group that we don't often think about are our military veterans. Veterans, even if they have health care through the VA, the world is a weird place in which you will give someone full medical and health care, but not dental care.
That's
It's
true.
not covered for
It's not.
routine veterans. And it makes me crazy to understand how people can not think that that is a part of routine healthcare.
Yeah.
You can be a veteran, go to the VA all the time, and still not get those couple of dental visits a year.
Right. It's a problem and it's a gap that we have to close, and we have to brainstorm just like this and come up with ways. Just like Dr. Lawson said about the mental health, we have to get hygienists in there. We have in those facilities. We have to get that should be maybe part of their exam phase, like go get their cleanings, and keep up with that because it does make a difference. It makes a big difference. And just
Okay.
even testing their bacteria to see, like, do they have the bacteria that goes to the brain?
So one other quick thing is we hear a lot about anti-inflammatory stuff, right? Then you could take this for inflammation and that for inflammation. Is there a link that you've heard of? Because even if the bacteria or the viruses or what have you are spinning around and floating around and trying to get at us, do some of those anti-inflammatory strategies help to mitigate some of the damage caused by the oral?
It absolutely does. It absolutely does. But also, it's going to still be there. So you may have some patients that respond well, and some patients that they just don't get down far enough. Their CRP levels are not coming down. Those patients probably have chronic infection, and you got to get rid of that chronic infection for that level to go down. So the resistant ones, that it's not working for, it doesn't work for everybody. And it's because their root cause has not been addressed. And if the root cause is
So we have a comment
Okay.
in the chat.
All right.
First of all, Dr. Dixon, everybody is just saying, excellent talk, excellent talk, excellent talk. So
thank you.
Ms. Howell, I want to ask Dr. Beverly Johnson to make a comment. Is
where
Dr.
that
Beverly
agrees
Johnson
on. I do see Dr. Johnson on, and
Simon? Do you see Dr. Beverly Johnson?
I don't. I'm
Johnson,
not up there. Let me see. Yes, B. Johnson, B.J. Johnson, B. Johnson.
She's not available to unmute right now.
Oh,
She's not available to unmute? Okay.
So
she can
there
type
is
in the chat.
a question about a history of early prevention in kids, and then Dr. Sherrod had her hand up again.
Okay. Go ahead.
So,
Okay,
from Dr. Gloria Ellis, who is on, asked a question about early prevention in kids. If you could comment on that, Dr. Dixon.
Definitely there should be oral prevention in children. So same thing at a pediatric office, ask the parent when's the last time they've been to the dentist. It is recommended that they take their child by age of 1 year old. And there's things that happen, like they get cavities, they get baby bottle syndrome. They're leaving their bottle in the baby's mouth, usually at least with the first kid until they figure it out. But it should be addressed at the pediatrician office as well, for sure. They need to get assessed for cavities because we see this cavity bacteria is actually more deadly in the heart than the periodontal bacteria.
Hmm. Wow.
Okay.
And Dr.
Dr. Sherrod?
We
Here
can
we
get
go.
Dr. Sherrod to
Oh,
Uh-huh.
yeah, I still have the question about your recommendations for root canals and whether you recommend
yeah.
them. Yeah,
I recommend root canals, but they have to be done well and they have to be also monitored. So once the root canal is done, they have a lot of antibacterial things that they flush the canal with that
uh-huh.
kill bacteria. If you don't get all that bacteria out and all those roots out, some people, if it's a complicated root system, I do recommend they just take the tooth out. But a lot of times, a lot of dentists don't know these oral systemic connections, like I said. And I did have a license to teach for the dental board, but I need to get one for the medical board so you guys can get continuing education units for these. But the dental board, I think I did that in like 2000. It was like before 2020, and after 2020 I didn't renew it, but I think I'm going to now. But definitely for the root canals, I refer a lot of those to the specialists. And I've heard some of the stories that they say, like, oh, people who have breast cancer have a root canal on the same side of the mouth that they had the breast cancer on. And I've heard that. I found, and I asked one of my patients, did you have the patient who had breast cancer? And do you know, two of them did. They had a root canal on the same side of their mouth that the breast cancer was. So but then when I did more research on it, they were like, that was not a valid study. And I can't find that study anywhere. And I do the research as far as looking up studies and finding these connections and stuff like that. So I think it was.
Well, are you familiar with the research that Dr. Mayo did, the founder of the Mayo Clinic, early on back in the 1920s? And it was like 30 years of study looking at the relationship between autoimmune disease and root canals.
Yeah, but back then they really didn't have the equipment and the new technology to treat root canals as they do now.
Absolutely. So
you know what I mean?
Yeah, so there's an improvement in the treatment process now that probably does not relate to that, because I worry about that because a lot of people get root canals, to try to save the tooth. And the other question I have is implants versus root canals. If you had to choose, would you choose the the implant over the root canal as far as infectious risk?
It depends on why you're losing the tooth.
Okay.
If you're losing the tooth, or if you have a lot of like gum disease around the tooth or something like that, I would recommend I wouldn't recommend the implant.
Okay.
Unless the doctor knows about these connections, because you're putting an implant in a site that gets infected.
And it's a foreign body.
Yeah. And so they were having a lot of failure. One time at a lecture I was at, they were talking about implants and they were like so happy because they found this flagell when it's crushed up in the grafting material for the bone graft. The bone heals with no holes in it. And they were so excited, but they didn't know why. So I said, hey, it's because this bacteria that eats bone, you guys are treating it with the antibiotic. So that's why it's you guys are getting better results. And they were like, wow, you're so smart. You should teach classes, But
well, you are so smart.
They're scratching their heads, figuring out, why are these implants failing? It's because you're putting it in the infection that was eating bone already. So how can you build bone in an infected site that eats bone? Like, you haven't cleaned that up yet. So,
Dr. Dixon, I thank you so much for your wonderful talk. We're at the top of the hour. Would you care to have some concluding remarks?
I'm going to send a couple of that flyer. I mean, that thing that showed the bleaching on there, and then you can share it. with the group on that. It's funny because I looked at it today. And then for Dr. Lisa, I'm going to send you the stuff on the testing rings, the rings for the
I'll
sleep.
hand carry hers to Jamaica. I want to go.
I do too. If you let me come on out there, I'll help you. We'll get these patients together, get them some oral appliances.
We thank you again so much, and you're going to be part of our family now.
Oh,
Thank you.
thank you. So now you guys
that-
send me invites. How do I become a member?
We give it a special handshake, Dr. Walsh. Keep it a secret handshake.
There it is. That's the secret handshake.
Okay. I'm an honorary member now.
Now, once you're in, you can't get out though.
Oh no.
One
Like
way.
a gang. Huh? Y'all a gang.
So Dr. Lawson, final comments?
Yeah,
Hold on, Dr. Dawes has her hand up. I think she's trying to invite us all to Jamaica. So
Okay.
Oh yeah, let's
unmute
go.
Dr. Dawes for a moment.
Actually, yeah, I mean, we can have you come down for one of our meetings here, or you can have
Oh,
another
that'd be
NMA
good.
meeting here. But yes, we can do that.
Okay.
Please contact me, and I do need your phone number.
Okay.
Especially, I was thinking about what you said. In most places of the world, heart attacks are the one that kill most people. In Jamaica's heart attacks and strokes are very high. And I'm thinking of most of our stroke patients in the hospital have really poor dentition.
Mm-hmm. And so that's where I want to do. I want to get like hygienists in the hospitals. Because when people come in with these like emergency diabetics and the heart attack, they need to get that cleaning like ASAP.
That should be interesting. They're trying to redo the system a little bit since Hurricane Melissa wiped out 1/3 of the island.
Oh, I know.
If we can, I don't know if we can get some money put into that. Interesting.
I can come train.
All
That,
right.
we can maybe work on that.
Yeah, because a lot of these hygienists too, they just polish teeth. They don't go down and get the bacteria out. And they have to if you do a thorough job, you're gonna clean them and get the infected tissue out to where they're not bleeding. So they should not. You should keep cleaning basically until they stop bleeding.
Really? I did
Yeah.
not know that.
And most people don't. Even the hygienists don't. So don't feel bad.
Well, I think dental care in our health system is actually quite poor. There are very few dentists. I know 2 of them in our dental system.
Well, maybe that's a thing we can look at, training some people to do these cleanings.
Okay.
Even if
Alright.
they're doing, we'll talk about it.
We'll talk. Yes.
All right. Thank you.
I
very
put my
much.
number up in the chat.
Okay. Dr. Lawson, final comments?
Yeah, again, I think this emphasizes the point that Dr. Dixon has made earlier, and that is that oral health is important in terms of a whole range of diseases. I had to do research in terms of looking at the relationship between taste preference and diabetes, and of course, then discovered not only a relationship, but that it depends on whether or not you're type 1 or type 2 diabetic or not. So again, hope we can get the word out and get oral health incorporated in terms of medical meetings and in terms of our community. The people that aren't getting these services are many of people of color as well as many underserved populations. The disturbing thing to me right now, the political, is that there's a concerted effort to restrict services that were made available through the Affordable Care Act and others. And I think we need to step out and make sure that in an attempt to cut healthcare spending, healthcare budget, that we don't take out these kinds of more specific disorders that unfortunately usually is the wealthy that get consistently.
Mm-hmm.
Thank you. And Dr. Walsh?
Absolutely.
So Dr. Johnson is able to screen share, it looks like, and so there's a slide on the screen, and Dr. Johnson put in the chat that she was not able to unmute. So I'm just looking at what I'm seeing on my screen.
Okay, Dr. Johnson is my friend. We went to school together,
Oh,
and
nice.
she wasn't able to unmute. I'm sorry, I wanted you to meet her, but you'll meet her at one point.
Okay.
Dr. Walks, any final comments?
So I do. Two things really quickly. First of all, Dr. Dixon, as everybody put in the chat, amazing talk. Thank you so much for coming back. Now that you're in the family, we expect to see you multiple times because your perspective is a really important one to add to the other perspectives from the other practicing clinicians. I'll just put us all in the clinicians bowl for a moment. And then as importantly, I would like to support and encourage you in the comment you made about needing to be able to teach so that folks can get CMEs. CMEs really do matter to a lot of folks as they're trying to continue their career. And if you are willing to actually get that done, and with all the folks that are so impressed by the quality and the content of your presentation, I think we could make something happen with that. So please do that. Get all the licenses you can. Teach the dentists, teach the doctors, teach everybody. So
I'm trying. I've been trying. Thank you.
Thank you so much. And next week, Dr. Lawson, I believe, is going to be our speaker. We'll talk about the details. And Med Kai is going to be on the Zoom. We look forward to you. And again, thank you so much, Dr. Dixon. I'll hopefully see you in the next week or two. I'm going to become your patient as well.
Thank
Have
you.
a great
And
day, everybody.
you sent me a patient. Thank you.
And thank you
I'm
so
honored to take care of her. Yeah. She got a hip replacement.
That's Holly Calhoun.
That's exactly.
85 years old.
Yeah, she was wonderful. Thank you so much.
Thank you, Simon. Have a great day.
Don't forget to invite me next week.
Okay.
All right.
Good day,
Have a
everyone.
good day.